Hello SLP,
Howdy.
back here with Dr. C more clearly yet again. What I'm going to do now is I'm going to do a quick medical check for you. Most of the work that I'll be doing will be similar to what we would do on a cranial nerve exam, but there's just a few extras which you'll come clearly later on. So what I've got first of all, I've got a nice little man here. If you want to hold on to that. If you give him a couple of squeezes, tell me, does he make a noise?
Yeah.
Sounds a bit like a heartbeat, doesn't it?
There's a bit. I don't know which. I'm hearing it better on this side, I think.
Right, we'll come to that later.
Thank you.
Alright, so part one. Next, I'm going to measure your head circumference. So for me to do this, I will need you to take your hat off for me. You'll notice I'm actually working from top to bottom. So, I'm just going to measure this in centimetres. And it's 53 centimetres. Right, my next measurement, I'll be doing a measurement. I'm measuring from the tip of your ear to the protrusion of your nose, which is called the crest height. This is the length to bend of a side if you was having new glasses. So what I want you to do, just turn your head to the side. That's 115 on the left. If you turn the other way for me. That's actually 116 millimetres. My next measurement, I'm going to do your pupil distance measurement. And to do that, I shall use this. I'm going to have to take my hat off for a second. I'm going to drop this down. This just stops me breathing all over you. You may not like my breath smell. Right, so what I'll do, I'll put this up against your head. What I want you to do now is, can you see a green dot?
Yes.
If you keep looking at the green dot for me. Thank you. Get that to 63.5 millimetres. That's 31 in the right, 32.5 in the left. I'm putting my hat back on. Right, the next thing I'm going to do, whilst we've got your hat off, I'm going to ask you to put this blindfold on. And we're going to do some touch and some smells, and possibly even some tasting.
Okay.
Alright, can you see my hand moving underneath?
And now.
Excellent. So my first thing I'm going to do, I'm going to do some touches. I want you to tell me where you can feel the touches.
Hands. Left cheek.
Does it tickle?
Not really. Forehead. Nose. Right ear. Left ear. Neck. Chin. Top of
expect you to feel that.
Left foot.
Right. So your touch, the sense of touch is very good.
Okay.
So I'm going to now give you something to eat, something to taste.
Not too many, I haven't had my dinner yet.
Or onto that. If you want to put that in your mouth for me. And see if you can tell me.
Is it strawberry?
It is, yes. Or strawberry what now?
I'm somewhat squidgy.
It's a soft sweet. It's actually a Haribo sweet.
I haven't tried one of these.
So, is it very sweet? Any sourness to it?
Not really.
And what about texture when you first put it in your mouth?
Squidgy, soft, and you could feel the sugar bits on it.
Right, excellent. I'm going to do some hearing checks now. But actually now, leave your mask on, because then you can't see where the sounds are coming from. What I want you to do is to tell me where they are. You can put your hat on now. Do you want me to pass it back to you? Have you got it? Well done. I know you're happier when your mask is on. When your hat's on, I should say. You look more like the Lone Ranger now.
The blind edition.
Right, so what I want to do at the moment, I'm just going to hold this in front of you, and I want you to tell me when you can stop hearing it.
No.
Excellent. I'm just going to try a higher pitch. Sorry, this is a lower pitch, isn't it?
Try that one again. There.
And you see the difference in the pitch? That was still going, but you couldn't hear it.
No.
Let's try something not quite so low pitched. Let's try that again.
There.
So that was just a fraction longer.
Maybe there.
Okay. Right, now I want you to tell me which side you can hear it the best. Is that clearer on the left or the right?
Left, I think.
Well done.
My left. That's right.
Definitely better with the right ear, isn't
So,
it? Just try a different sound.
stopped about that.
Yeah, which side did you hear it
I
clearest?
couldn't tell. That's left, my left. That's definitely right. It's better. Left.
Excellent. Now, you was getting better sound, a lot clearer sound from your right ear than your left. So what I'm going to do, I'm just going to get my otoscope out. I'm just going to have a quick look in your ear. I'm just going to have a quick look in your ear now. Just turn your head to your right slightly. That's great. Although it's not that bad, you have got a slight build-up of wax in there. I can syringe that out now if you want me to.
Okay.
Right, let me just do that now for you. Oh, I want to laugh. Because it can get very messy when we're doing the syringing. Right, you hold on to that just to catch anything. But there's quite a lot came out of that.
Right.
Now we'll try the tuning fork again.
Seems better to me. Yeah. Still a bit better on this side, but improved.
Well, that's improved. Good. That's what we were after. And you see, the malpractice hospital still has its benefits. Right, I'm going to give you something to hold on to, or to touch with your finger. Just hold your finger out and tell me what this is. Eating utensils, what's that one that you can feel?
Is that a fork?
You hold on to it actually.
Oh, that's a little spoon.
What about this side? Just be careful of any sharp.
It's like a corkscrew.
Yeah.
It's a bigger spoon. Possibly a bottle opener of some description.
Bottle opener and a tin opener. There's two together on there. Last but not least.
That's a fork.
Well done. You can remove the blindfold if you want to. Just going to record what I've done. Right, so my next thing to do, I'm going to show you something. You told me about you having a problem with a lot of noise at night time. So what I've got here, I'm not going to open them now. They're good for 2 or 3 uses. If you see anything slightly discoloured on there, you know to throw them away and to get some new ones. But there's some nice little earplugs for you.
Thank you.
You feel how squishy they are.
Yeah, because I've been used to the more firmer ones.
Yeah.
This might be a good idea.
Now what I want to do is have a quick look in your mouth.
Mm.
I've got the mirror here so I can actually just check your teeth just to make sure everything is all okay. So what I want you to do is open your mouth for me. Yep, everything looks okay. The top of your mouth is, the roof of your mouth is fine, and your tongue is fine. Just lift your tongue up. That's great, thank you. You've not been getting any sore throats at all, have you? No. Right, I just want to check. I'm not doing an eye test or anything like that, so I'm not going to do everything that way. What I want you to do is just put these glasses on. Nice cute little things. They fold up nicely. And I want you to tell me, when you look around the room, is everything clear or does it look a little bit blurry?
Slightly blurry.
Excellent. That's what I was hoping you would say. I'm just going to give you these little things to look at. Now, is that clear with them glasses on?
Yeah.
What about this one?
Yeah.
And if you look at that one, I bet you're wondering what these are actually, aren't you?
Somewhat optical, isn't it?
Oh, definitely, which is why I've gone with your glasses on. These are for measuring varifocals to make sure that the varifocals are sitting in the correct position. Now, on the back of this one, you've already seen the front on this one, but here's another one with the back. Now, that's measuring the bow of the frame. So that is, if I take my glasses off, I can show you. So it's measuring that.
Right. Is that an important measurement?
It is, because if the glasses are too bowed, you'll get double vision. And if they're not bowed enough, you'll get double vision, but the other way. You may not see it as double vision, you might see it as blurred vision.
Still clear.
And
Yep.
the last but not least,
Yeah. It's fine.
excellent. Something that they like to do well here is, this is the college where I did my course. It's actually a manor house down in the Garden of England in Kent, near to Canterbury.
Very pretty there, isn't it?
Lovely, isn't it? It's not many colleges are a mansion house.
I haven't got to count the windows, have I?
No. But there is something to be said as well. On the English £5 note, that building is on there.
Is it?
So it's the only college in the country that's on a banknote.
I'll have to check that out then. I like the island in the centre as well.
Yeah, you don't have to reverse, you drive in and
You know
drive
you've come up
round.
in the world and you've got an island outside your head.
Yeah. Right, the next thing I want to do, I just want to do a quick check on your heart and your pulse. And then I've got one more measurement after that. Right, so what I'm going to do now, I'm just going to check your heart. Right, if you want to just pull your sleeve up slightly, just twist that round. I know I need to call an ambulance. Your pulse has stopped. I'm just going to check now your lungs. So I'm just going to come round behind you. That's right, you stay that way. I'm just going to come round this way. Nice big breath. And let it out. And again. That's fine. That all seems okay. I'm just going to check your reflexes on your knees. So that's fine. That's fine. Right, was there anything else that you wanted me to?
I don't think so, no. The other ear was okay, wasn't it?
It was, yes.
Okay.
Yep. When I checked for that, it was only because the sound was reduced that I actually checked that to make sure.
Okay.
And we did notice a little bit of wax because that wasn't very bad. I didn't bother checking the right ear. All right.
Okay, lovely.
I think we've covered everything there.
Thank you.